Instead of recommending that all babies receive the hepatitis B vaccine, they recommended that it be a shared decision-making process with parents, whether or not to administer the vaccine. And then they also recommended that the first dose of the vaccine not be given until 2 months of age, rather than what's recommended now, which is at birth. The implications of that is that children who are born to potentially undetected hepatitis B positive mothers may be at higher risk of contracting the disease. And because the disease is so infectious, the number of children who are in the community with undetected disease means that there's people and children who are going to be exposed to the virus and not be protected. Before we had the vaccine, there were many people who had hepatitis B in this country, on the order of millions. When we were addressing why is that happening and what can we do about it, there were steps that people were taking, recommending the vaccine in high-risk individuals. None of that worked. That was in place for about 10 years. After that, they decided to recommend universal vaccination for babies. And that was really the only thing that decreased the rate of infection in this country. My worry is that if we stop giving the vaccination to babies, that there is going to be a number of children who are infected or at risk for being infected from undetected infection in their mothers that then go on to develop chronic hepatitis B. Hepatitis B is a very tricky virus. It's a complex and tricky virus, meaning it's very hard to treat and it's very hard to cure. In fact, what I talk about when I talk to my patients is that this is an incurable disease. It requires medicine. It can lead to progressive liver function decline and liver failure and need for transplant, and it can lead to liver cancer. It's like safety in cars. A seatbelt only works if you use it. So if you have a seatbelt in a car and you don't use it, you won't be protected against any accident or any injury that happens. The vaccine is like that. The more you have the vaccine on board, the more protection you have for a longer period of time. If you don't receive the vaccine, you're not protected. Hepatitis B is what we call a very hardy virus. It survives on surfaces for up to 7 days. It has enough particles per undetectable amount of blood that can cause an infection. So it's a very high risk infection that we really have no idea like how much exposure you would have to on playgrounds, during sports games, etc. And children are vulnerable to that infection. And the other thing is that they don't show any signs of the infection. And so it's really impossible to predict or detect when it's there. And so people will be unwittingly spreading the virus if there's no protection provided by the vaccine. If you do this vaccination, there's a very high likelihood your child will be completely protected against this very infectious virus that is otherwise undetectable in any way. You can't tell if somebody has it. You can't tell on a service if it's existing. And so this is the best thing you can do to protect your child. It is safe, it is effective, and it is the one thing that we've been able to use to reduce the incidence of this very common and very impactful disease. Hepatitis B is on people's minds and in discussions. And my hope is that increasing awareness will lead to increasing awareness about protecting people in their second, third, fourth decades of life, possibly giving more boosters awareness about the disease and hopefully helping us in that way.